Team Phoenix, and welcome to my YouTube channel. Oh my gosh, I've missed everybody. I've missed you people. So when I started this YouTube channel, there were two main areas that I was going to cover. Number one, healthcare workers and their issues. So it has emerged that everybody is dying to learn more about nursing in the United Kingdom. It is fine. It is okay. It is well. It is well with my soul. It is well. I'll continue doing this. And furthermore, I will also continue doing about the same for other cadres of healthcare. And I will also talk about senior carers in the United Kingdom. But, you cannot steal me from the other objective of this YouTube channel. And that is talking about medical conditions in a simple language. So for today, everybody, we are going to do exactly that. We are carrying on from where we stopped last time. So today we are talking about stages of kidney disease, especially stages of chronic kidney disease. So sit back, relax, enjoy. When I think about chronic kidney disease, sometimes I don't have the requisite material to be able to express or even explain and demonstrate or even illustrate what I mean by stages of chronic kidney disease. So there are two things that can go wrong in chronic kidney disease, and that is where we get our stages from. So the filtering mechanism of our kidneys, remember we talked about functions of the kidneys, and we said that the most basic one is formation of urine. So how are we forming urine? We are forming urine by filtering the blood. So blood keeps going to the kidney at any point we are sitting or standing or sleeping or whatever we are doing, and we get urine. So if this sieve of ours has a problem, then we are going to end up with either materials passing through that are not supposed to pass through, or occlusion, which means materials that are supposed to pass through are not going to pass through. Okay, that is what happens, and that is where we are getting our stages from. When you think about this sieve right here as our kidney, okay, look at those holes. There are some tiny little holes which are the normal kidney filtering mechanisms, and we have the larger holes which are going to allow things to pass through that are not supposed to pass through. The other thing is that we can have occlusion. So when we have some form of occlusion in our kidneys, then we are going to experience material that are supposed to pass through not passing through. For example, if we need water to pass through, water is not going to pass through. If we need urea to pass through, it is not going to pass through because we have some form of occlusion, and that is where you're going to get our problems. We are saying that in stage 1, 2, we do not have any signs and symptoms. There's nothing that is happening in the body that can alert us to a problem. And at this point, the patient is okay. Actually, they will be very surprised when we, as the healthcare providers, say that they have some form of kidney damage. Problems start kicking in stage 3. A and B, because there is A and there is B. That is where problems start coming in. And that is why we are saying it is quite important for you and I to know that this sieve of ours is very important, and whatever happens, we need to take care of it. Okay, I hope that makes sense a little. Kidney replacement therapy is simply some form of treatment whereby we need to sustain life. Remember, stage 5 chronic kidney disease is also called end-stage kidney disease or end-stage renal disease. Now, what are we talking about? We are talking about end of life. If we do not do something in stage 5 kidney disease, we will lose you. We will lose the person that you love. We will lose the patient. So we need to do something. And this something comes in form of different types of treatment. The most common one is actually dialysis. We have two forms of dialysis. We have peritoneal dialysis. We have hemodialysis. We also have kidney transplantation. It is the surest way of treating kidney disease stage 5, but then again we are faced by a global shortage of kidneys. Organ donation is not so widely accepted, especially in my country where we only do living related donation, meaning that you must be related to somebody, probably emotionally or even in the family. You need to be related to this person for you to give them the kidney. But then again, even emotional relation in Kenya, it really has to undergo a lot of tests and approvals for it to be accepted as potential or plausible means of kidney donation. In other countries like the United Kingdom, we have organ donation, we have cadaveric donation. That is whereby when a person is on life support and they are brain dead, they could have written a will that They want their organs or their kidneys harvested and they can help somebody else. Or maybe if somebody is involved in a car accident, they could say, should I die, then my organs, I need them to be used for somebody else. Somebody else might say, you know what, no matter if anything ever happens to me and I die a natural death, whatever is the case, if my organs are fine, you guys, you can have them and they can help somebody else. We are faced by an acute shortage because it is still a very emotive issue when it comes to kidney transplantation. Some people say, oh, I want to be buried with all my organs. It is neither here nor there. I don't want to go into the details of that. What I want you to realize as people, my lovely Team Phoenix, is the fact that it is very, very, very sad that we keep needing kidneys, but we don't have enough. So we end up starting people on dialysis. The hemodialysis is whereby we use a machine and an external kidney, that is a fake kidney. It's called a dialyzer. And we get blood from your system, take it to the machine for clinic through the artificial kidney called the dialyzer, and then return it to your body. It is a very traumatizing experience, especially for somebody who has just come to the unit and they have been told that they have kidney failure and they need to start dialysis. It is quite traumatizing. So what am I trying to say? I'm trying to say, let us slow down the progression of kidney disease. We have seen the different stages. I know my illustration was not the best in the whole world, but at least it's something, isn't it? Excuse me. At least it is something. So remember, when we are clogging those pores or we are drilling holes into the pores of the kidneys, probably through diabetes, through hypertension, through polycystic kidney disease and other causes like drug intoxication, alcohol poisoning and things like that. So when you are doing that to our kidneys, it means that we need to reverse the cause, okay? If we reverse the cause, then we can remain at stage 1 and 2 for as long as possible. If we can reach stage 3, then we can start using medications that are going to protect our kidneys. And if you are obese, for example, you're obese, you're smoking, you take too much alcohol, this is a very good opportunity for you to stop. Now, I ask myself, what if patients had an opportunity of knowing that I'm in stage 3, but if I do something about my health today, then I will not reach stage 5. So that means that you will have inspired this patient to do something about their own life, and it will save us costs, it will save us resources, it will help us focus on the patients that are already on the machines. Okay, everybody, so let us slow down the progression of kidney disease. Patients who have diabetes, hypertension, polycystic kidney disease, or any other disease that can cause kidney injury, kidney disease, it is a high time that you have your kidneys examined, especially the two leading causes, that is diabetes and hypertension. You must have your kidneys assessed. It does not matter that your doctor has not told you that the kidneys are failing. Come on, you are in charge of your own healthcare. And I could not have started this channel had I not known that you have the power to change yourself. You have the power to say something about how we are taking care of you as healthcare providers. So I want you to go out there today, talk to your doctor. If you're a carer, by carer I mean somebody who takes care of somebody else, okay? That is what it means in this context. If you're a carer, that is a relative or you're a daughter or maybe a child to a parent who has such a condition, you must let the doctors test your mom, your dad, your granny, or your relative. Let them be tested for kidney function. And if the kidneys have started to fail or the kidneys have slight damage, ask the doctor what can be done about this. I do not want people to end up on dialysis. We can stop it. That is what we need to do right now. So do me a favor, go out there, test your kidneys, have them checked. Tafadhali, please. Tafadhali is Swahili for please. Please have your kidneys function examined, because it is important to do so, ladies and gentlemen and others. It is quite important for you to have the kidneys checked. I usually say that for diabetes and hypertension, at least every 6 months, have your kidneys checked. And if your diabetes is uncontrolled, if your hypertension is uncontrolled, do it more frequently, perhaps 3 months. It is not a very expensive test. See, there is the simple urine test. Surely, it is less than $1. Anywhere in the world, that test is less than $1. So you cannot tell me, you cannot hide under the fact that all cost and everything. See, other books are calling a urine test a poor man's kidney biopsy, you know, a poor man's kidney biopsy, which I found very intriguing and quite cute, to be sincere, because if you do that simple test, it can even be done in your house. For people in the United Kingdom, in the States, and also people in Kenya who can afford this, just buy urine dipsticks. They are called dipsticks. These are tests that you can do yourself in the house, in the morning, in the bathroom. You can do it. But for everybody else who might not be in a position to access this, go to your local chemist, especially chemists in Kenya, I know, and laboratories in Kenya, I know that they do these urine tests. It is less than $1. I'll keep on insisting on that. Please spare it. Just have a urine test done, okay? Because it will show us, do we have proteins in urine? Do we have blood cells? Do we have other things that should not be found in urine and they're being found? Now listen, if you're finding anything in urine, remember where it is passing through, our sieve, and that is our kidneys. So whatever you're finding in urine, it is reflective of the processes that are happening in our kidneys. So you need to do that simple urine test. Other complicated tests can be done, perhaps for people who are undergoing all these other follow-up for different diseases, like we have said, chronic kidney, we have talked about diabetes, and we have also talked about hypertension. People can undergo other tests, but in the meantime, can we just do a simple urine test, okay? It is as simple as that. And everybody else, let us slow down the progression of chronic kidney disease. We can do this for people who are living with diabetes, for people who are living with hypertension, and all the other issues that can cause chronic kidney disease. Now, I will be very happy if we can go back to signs and symptoms of kidney disease. Kindly check the video that I will put to this one. I will link a video up here. I'm not sure which side. Up here. So go ahead and check it out. Please check it out, check it out. This is important because we cannot do this if we do not have this conversation, okay? So until next time, when we will be talking about two of those diseases, that is we will try and look at the causes of kidney disease, okay? So I will try and talk about diabetes, I'll try and talk about hypertension and how they are related to chronic kidney disease. So what exactly happens? And what if I'm not feeling any pain? Because these are silent killers, and that is the problem with these diseases. They are silent killers. You're not feeling pain. You're not rush to go and find any medical attention. But then again, if you're in pain, that is when you will realize that you need to rush. But then again, we are saying it does not have to be like that. So what happens? What really happens? Perhaps you understanding what happens will help you take it seriously. I really hope so. So we continue doing this, okay? So until next time, everybody, thank you for watching my channel. Kindly subscribe, really share with your pals, talk to somebody, let them understand that there's a nurse here who talks about different health conditions in a very simple language, because it is important that you understand it without the medical jargon, okay? So until next time.